And you're welcome. It's time for some health talk here with us, and we are talking about preventable dental diseases with Dr. Femi Aderiye. He's the CEO of Pearl Dental Clinic, Lagos. He's a dedicated clinician with a passion for the highest standards in clinical dentistry. You are welcome.
Thank you.
It's good to have you here, Dr. Aderiye, because yesterday I had a root canal.
Oh, wow.
Yeah, I've been dreading it for years.
And how did it go?
I think at the end of the day, like I told my colleagues, I was actually more afraid of fear itself than I was of the pain that I was going to feel. So it was pleasant. It was my very first, or maybe say one of very few pleasant experiences I had had with a dentist. My very first one was traumatic, ended up in me losing one tooth. And then the second one was even, more traumatic. So I've always been scared of dentists. But after yesterday's experience, I think, it's gotten better.
So we're not so bad after all?
Not so bad. No, you guys are nice people. In fact, I'm going back today again and then next week and then on. Because
don't make it a habit.
Yes, indeed I will. But let's talk about preventable dental diseases. Yeah. What are some examples of these preventable dental diseases?
Well, preventable dental diseases are dental infections or conditions that can be prevented by your actions. That's our actions as individuals. So I will talk about the most common one, which is tooth decay, which is probably what led to your root canal yesterday. Yeah. So tooth decay is a condition where you lose hard tissue due to bacterial infection in the mouth. The bacteria that causes it is actually present in your mouth normally, but it's just that it could grow to an elevated concentration and begin to cause problems. So when the imbalance happens, then the decay starts. Aside from that, of course, the anatomy, your habits, things you do, basically, your oral hygiene habits, your diet, your dietary habits, and your diet as well. So talking about tooth decay, or caries, the most common one is a simple caries that happens on one or two teeth. But you have situations where you can have a lot of cavities on several teeth, at least more than 10 teeth. That's what we call rampant caries. I harp on that because it's become quite prevalent in this part of the world due to our progressive adaptation of Western diets, high sugar intake, processed carbohydrates, and all of that. And I'm going to harp on this because it affects children. Tooth decay in children is on the increase. Oh, wow. All right? And it is very preventable. So we'll talk about rampant caries that occurs in more than 10 teeth. Also called feeding bottle caries.
How so?
Well, so some mothers, I'm not blaming them, because the children are soothed by these things. They feed their children too late in the night, and they fall asleep with formula, with the feeding bottle in their mouth. And that exposure, that continued exposure to processed sugars rots the teeth. Oh, really? So at Pearl, there was a lady who came in with her 3-year-old, and the minute I looked in his mouth, I called the parents in and basically taught them about rampant caries and what causes it. So they had to alter the time of feeding, the kind of food they gave the child at particular times of the day, and not just your oral hygiene practice where you brush twice a day and floss every day as well. But the easiest way to prevent this is proper oral hygiene. Yeah, that's number one, and then dietary control, of course. As well as other habits that you might inculcate during the day. So don't eat too late and don't go to bed without brushing your teeth. Okay, now that's something that's very hard for Nigerians because we'll just get home and then that is it. It's all over. But then you keep saying dietary habits. Yes. Now, I have the idea that it's caused by what we eat. What exactly could cause, what foods exactly could cause our tooth to decay? All right, so the common misconception is people think it's just sugar, right? So sugar is a derivative of carbohydrates. So any carbohydrate you eat can potentially cause decay because it's broken down into sugar by your body from your mouth. So yam, plantain, but the kind of carbohydrate matters as well. So things like plantain or dodo, as we call it. It's not bad. It's bad for the teeth if you eat it and then you don't brush out. Okay. So that's what I mean by dietary habits and diet. So the kind of carbohydrate, the kind of sugar you eat, it matters because there's some sugar that doesn't cause decay. And those are the ones you find in the xylitol, find in chewing gum.
Okay.
They're using gum.
Cool. So I'm going in today for a bit of scaling.
Okay.
Now, what causes scales on the teeth?
Okay, this is a natural buildup, and it happens to everybody.
Okay.
So what you're talking about is calculus, or tartar, as the North Americans call it. It's a calcified deposit that builds up on the surface of the teeth.
Okay.
It starts as a soft amorphous deposit called plaque. And if it's left there, it hardens over time by absorbing minerals, calcium, from your teeth and from your diet as well. It's commonly found in between the teeth, that's the interdental spaces, but if it's really bad, it can now grow and come out on the buccal and outside on the inside surface of your teeth.
Okay.
The scaling, as you call it, is the mechanical removal of this tartar or calculus.
Which, by the way, feels very satisfying. I don't know why, I just enjoy it.
You enjoy it?
I actually enjoy it. I like the
you
fact.
should be a dentist, you know.
Well, yeah, I have been told that, but it's too late already. Broadcasting got me.
No, you can be a broadcasting dentist.
Nice.
Yes.
We'll take a look at that later.
All right.
But yeah, so what's the worst case scenario that could happen in that case where you don't scale? I've met people who say, oh, I've never been to the dentist. And I'm like shocked to hear that. So I can only imagine the amount of buildup of plaque in their mouths.
Well, that is possible. But I've also met people who say, this is my first time at the dentist.
And they have pristine teeth.
Yes, because their oral hygiene practices are pristine. They brush twice a day and they floss. So I'm shocked. I'm like, wow, you've never been to the dentist. Okay, that means you really must take care of your teeth. And then, yes, I brush twice a day and I floss all the time and all that. So, but there are those who've never been and they really just scrub and briefly 1 minute and they're out of the bathroom because you know they have a bus to catch or they have an appointment to meet up.
Mostly Goshen's.
Yes, so mostly Goshen's, of course.
Then let's talk about oral mouth odor as it relates to decaying tooth. How is that a thing, and what do people need to know about mouth odor and when to check their teeth?
Mouth odor is very diverse, as in it's very wide. The causes are numerous, but you can narrow it down to two classifications. Intraoral causes, extraoral causes. Extraoral causes meaning causes that are not in the mouth. So bad breath, halitosis. It is a common complaint, and there are ways to diagnose it. And once you have a diagnosis, then you can have your treatment.
Okay.
So it could be from your mouth, like I said, and it could be from outside your mouth. It could be your lungs, it could be your GIT, in which case you need to see other specialists.
Okay.
So, but when it comes to tooth decay and it being caused by tooth decay, halitosis being caused by tooth decay, then basically, or either tooth decay or periodontitis, that's infection of the gums, a gum infection. Those conditions, there are two things common with them. There's decay. Now, with decay, there's going to be, foul breath. There's a production of sulfur as a byproduct of the decay.
Basically, check with your dentist. And you say, what, once in 6 months?
Come in every 6 months for a checkup and a clean, and you'll be right as rain.
Fantastic. So you heard already, no matter how good your dental hygiene is, it will save you a bit of, this and that, maybe even self-esteem if you saw your dentist once every 6 months. Thank you very much, Dr. Aderiye, for coming in.
Thank you.
Appreciate it. And we look forward to seeing you in again. Let's talk more about dental hygiene.
I'll be happy.